Good afternoon, Ms. Johnson. My name is Dr. Smith, and I'm one of the therapists here.
Hi, Dr. Smith. It's nice to meet you.
It's nice to meet you, too. So I received a referral this morning from your primary care physician, Dr. Jones, and he shared with me that you've been experiencing some unusual behavior and symptoms that raised quite a few red flags to him. He thought that it would be real beneficial and helpful if we met together to discuss some of these things. Would you mind sharing with me about what's been going on?
Yeah, lately I just felt a lack of energy and motivation. I always feel tired. Nothing motivates me to get out of bed in the morning. I've been calling out of work a lot more recently. I feel sad all the time. Nothing seems to make me happy or motivate me. I don't feel the need to check my phone to see if my friends or family have even contacted me.
So, what would you say that your typical morning is like for you?
Well, I typically just wake up and then call into work sick and then go back to sleep until about 2 in the afternoon.
How has all of this sleeping been affecting your work schedule?
Well, when I sleep, time passes by faster, and those are hours that I don't have to be awake and sad all the time with people trying to check in on me. My boss has told me multiple times that if these behaviors continue, I could lose my job, but honestly, I could care less.
Well, that's important that we address the work because work's real important to get out and go to. So, when you're not sleeping, do you have any interests or hobbies that you enjoy?
Well, I guess I used to enjoy going out with my friends or spending time with my nieces and nephews. I used to scrapbook some. I also used to like to go to the gym, but right now, none of those things really make me happy or motivate me to get out of bed. Spending time with people is just not something that I have any desire to do anymore. I don't see, I don't like seeing all of them happy, and I can't even fake happiness when I'm with them. So I don't see a point of being around them. I don't see any point in going to the gym anymore either because like my body weight is what it is. There's no reason to change it. I don't have any desire to look at old pictures either because then I see people happy and I know it's not possible for me.
Yeah, I know that's real hard. Would you say that there's a possibility of you feeling worthless?
Yeah, I mean, I question each day like why I'm awake and why hasn't my life ended yet.
Hmm. Have you harmed yourself in any way or had any thoughts about self harm?
Um, I've thought about the possibility of attempting suicide a few times, but then I realized how much energy that would take for me. I barely even have the energy to get up and go to work, and when I do, it's very taxing. So, taking the energy to plan out my own suicide, that just seems too much.
Well, these are certainly some important things to know and uh, important that we address these things together. Have you had any of these depressive symptoms in the past, or is this your first time experiencing them?
I mean, in the past, I felt sad and down, but after a while, it just goes back to normal. I thought it was maybe just a phase I was going through, but this time everything just seems so much worse.
So, are there things that trigger this, or is it just kind of out of the blue, or just when you wake up it happens?
Um, well, I wouldn't really say anything triggered it. It's not really out of the blue because it's kind of just how I feel all the time now. I can never escape the feeling of sadness, or I just want to sleep all the time.
Yeah. So, during the period of time that you weren't experiencing these sad and depressive symptoms, were you happy and genuinely enjoying your life and motivated to go out and do things?
I mean, I guess I just felt like a normal, everyday person going through the motions of life.
So, between the period when you first felt sad and depressed and now as things have increased, was it just a period of normalcy? And has it just now become more clear when they've been occurring again?
Yeah, I guess it just hit me like a rock one day after the break of not having those feelings.
Yeah. Have any of your family members or your friends shared that they've observed some of these changes and expressed any concern to you?
No, but I haven't really given them an opportunity to be around me to observe the behavior changes. I usually don't have my phone on me, and when I do, I don't like to check it. I've stopped updating and checking any of my social media accounts too. People try to call me, but I typically just ignore them. I have no desire to talk to anyone or participate in any activities with my friends. I know it bothers them, and I assume they're probably worried about me, but I just don't feel like trying to explain all this to them or being bothered by them.
Hmm. Yeah, well, I'm sure they don't understand all that you're going through and dealing with.
Yeah, I know they don't. I mean, they think I'm mad at them probably or something, but that's not really my concern. It's their choice if they choose to take this personally.
Mm, yeah. Well, unfortunately, this can happen, and it's not easy to deal with. To your knowledge, do you know of anybody else in your family that has experienced any of these problems or behaviors?
Uh, I think I remember growing up that my father was depressed some and kind of experiencing some of what I've been dealing with, I guess. I mean, he didn't really want to be around me or my siblings or my mom. He just kind of spent the majority of his days in his room, and it wasn't out of the ordinary for the phone to ring and it be his boss at work asking where he was, and eventually he got fired because he didn't show up.
Mm, yeah, that's hard. I'm sure that's impacted you a lot now. Have you had any recent deaths or events in your family?
None that I know of.
Mhm. Well, after discussing this, I would like to further review your family history and your medical history. From all that we've discussed this far um, and what you've shared with me, there's a problem that we refer to as major depressive disorder. Disorder has a range of severities, but this seems to be a very severe case that we're talking about here with you. Your entire life is being impacted by this, and it's something that really needs to be addressed. Your feelings of you being drained and your lack of energy, your lack of interest, and extreme fatigue are a real area of concern. You're not alone in this, and there are this is a very common diagnosis against individuals and society, and treatment methods have been tested and fortunately been found to help individuals with their symptoms to help them out. So the first thing that we would like to try with you is cognitive behavioral therapy. Mm. So this method has been proven to help in managing and changing your thinking style and the behaviors that you have that are causing you to feel real depressed and sluggish. This can also help in recognizing your thought patterns and your behaviors that are related to you feeling depressed and hopefully changing those for you. I would also like to give drug treatment try in combination with the cognitive behavioral therapy to help with this treatment and to do our best to manage these depressive feelings and get you back to work and being with your family and friends. Along with those two treatments, I would like for you to come back and see me as often as you feel that's needed for as long as you feel is needed. And you can always give me a call or email me at any time you need, but I'm going to write you a referral to Dr. King, who's going to assist you in getting a start with your therapy and your drug treatment. But it was real nice meeting you today, and I appreciate you coming in so that we can get you going on your treatment methods, and I look forward to seeing you again.
All right, well, thank you so much.